Hello, my name is Liana. I'm the PA that'll be seeing you today at the ASMR Urgent Care. What's bringing you in today? You feel like you have a bad UTI? Okay. What are some of the symptoms that you feel like you're experiencing today? Hurts to urinate? You feel like you're going to the bathroom more? Okay. Do you have like a urinary urgency at all? Okay. Any back pain or any pelvic pain? Yeah, I can definitely tell that you're a bit uncomfortable for sure. It's kind of like a fullness, a pressure. Okay. Any sharp stabbing pains? Okay. Gotcha. Now, I just have to ask some general questions since I've never met you. Do you have any medical conditions that I should be aware of? And are there any medications at this time that you're taking? Kind of as needed? Okay. Any allergies to medications that I should be aware of? Okay. What about surgeries that you've had? Any within the past year? Do you smoke at all, whether it's tobacco or marijuana? And how often? And how does your general body feel? Fever, chills, anything like that? Just some fatigue. Okay. And before we get started on your exam, can you confirm first, last name, and date of birth? And did you drive yourself to the urgent care today? Okay. Alrighty. So I'll probably start with some vital signs. May take a quick listen at your heart, lungs, and abdomen. And then you left us a urine sample for us to test after that. Good. Have you had a urinary tract infection before? Symptoms are pretty similar. Okay. You know, our biggest thing when people come in for UTI symptoms is ruling out the potential complication of having a kidney infection. Normally with kidney infections, you'd present with fever, chills. It would be very, very obvious that you were extremely uncomfortable, where you wouldn't even be able to lie down or anything like that. And then I'll be tapping on your back to see if you have any flank pain. So we're going to keep an eye out for that, okay? Yeah. Okay, let me just put some sanitizer on here, and we'll start just with some general vital signs. Do you have an arm preference for the blood pressure cuff? Can you slide your arm in that for me? Cool. Just gotta secure it here. Just make sure it's gripped onto your arm tightly. I'm gonna take a quick listen. Pardon my reach. Pressure's just a little bit elevated, but nothing alarming by any means. I'm gonna take this off here. you mind sticking your arm out? There you go. All right. So, decent blood pressure on you here. Let's check that temperature. Anybody around you sick at home? That's good. Gonna go, sorry, I'm moving a little down here. It's gonna go right underneath your tongue. Just gotta wait a little bit for that to work and kind of measure accurately your temp. Okay, so good news is no fever, so that's really what we're looking out for there. Temp is good. And you weren't having the night or cold sweats or anything. Good, good. Let me just throw this away. Okay. Now I am just going to do like a quick general assessment. So I'm going to put some gloves on. Just get heart and lung sounds. Check your pupils. Just to be as thorough as we can be, given it could just be a UTI, which you really never know. Okay. So, I'm just going to take a quick listen to your heart. You can breathe normally, of course. Listening to the different valves. Okay. Good. We're going to do some lung sounds now. Can you take a deep breath in for me? And out. Deep breath in. And out. Deep breath in. And out. Deep breath in and out. Take a quick listen at the arteries here. Good. Okay. If you wouldn't mind looking straight across, try not to move your head. Just taking a look at your eyes here. I'm going to lift your lids just for a second. Can you say ah for me? Okay. Do you mind lifting your nose up? Okay. I'm going to take a quick look at this ear. Okay. Good. I'm going to just lean over here for a second, okay? No signs of infection in that ear either. Okay. Next up, we're going to do kind of a more comprehensive abdominal exam. I'm just going to move your gown a little bit. We are just going to start with like a general skin inspection of your abdomen. And you said just like that fullness. Next up, I'm just going to do some percussion. A couple more step, we're going to start with superficial palpation. When I press superficially, and then a deeper palpation. Starting in the 4 quadrants. Okay, now we're going to go a little bit deeper, so I'm sorry if this is uncomfortable. Right over here. Okay. Okay, gotcha. Just gotta press a little bit more, okay? Sorry if this is uncomfortable. Kind of noting for any enlargements in the organs here. Skin changes. I do have to tap on your back. Do you mind flipping over to one side for me the best that you can? Yeah, just a little bit is all I need. Any pain on this side? Good. Okay, let's see if we can flip you a little bit on this side. Okay, and move you down over here. Any pain? Good. Alrighty. Let's see here. So, the next thing I want to do is let's test that urine that you left us, okay? Swirl it around a little bit. Yeah, so it's basically a strip that'll tell us if there's any blood, leukocytes, nitrates, sugars. Okay. So we just gotta wait a little bit for that to load. It is starting to show some bacteria for sure, as well as a little bit of blood. Have you visibly been able to see blood in your urine? Okay. Yeah, definitely looking like a classic urinary tract infection. Yeah, no doubt about it. So here, I'm just gonna clean this off a little bit. I am actually going to send your urine out for a culture to make sure that the antibiotic I give you today is able to help manage and treat the type of infection that you have. So let me just write your name out for a culture here. So I will be sure to send that out. Let me take these gloves off. And I do have antibiotics here in the clinic that I can give you. Definitely get started on them. Let me see. I'm going to grab your chart here and then we'll kind of talk about the plan. So, definitely looking like a urinary tract infection. You want to make sure that you stay super well hydrated the next few days. A lot of water, at least 64 ounces. If you ever feel like you have to pee, go to the bathroom. Try not to hold it in, okay? Yeah. And then you are going to take these antibiotic prescriptions twice a day for 5 days, and to confirm no allergies, right? Okay. So I'm going to make these for you. Like I said, for 5 days. If at any point, though, you feel like your symptoms are getting worse, you start developing severe flank pain or start getting a fever or chills, you have to go straight to the hospital, okay? Because kidney infections can be very scary and in some cases life-threatening. Yep, exactly. All right, so I am going to write these instructions for you to go. You have your pills here. I'll give you some privacy to get dressed, and then the girls will see you at checkout for the instructions, as well as some general information on urinary tract infections and how you can prevent them for the future. Absolutely, no, it is not a problem at all. And please, please, don't ignore any alarming signs or symptoms that we talked about. Absolutely. All right, and we'll try to have a good rest of your day, and hopefully you'll be feeling a lot better soon. Absolutely. I'll see you.